Could the new GLP-1 inhibitors like Wegovy, Ozempic, and Mounjaro help just about any medical condition? Maybe one that you have. Maybe it's something you should consider. Well, according to the Wall Street Journal here, Ozempic for everyone, doctors hail GLP-1s. Should everybody be taking them? Should they be put in the water? Let's discuss it. So as this article states, it starts right away. Should Ozempic be added to the water supply? And the short answer is, look, the article goes through all the benefits of Ozempic, all the trials that have shown some benefit to Ozempic. But my question is, are the problems fixed, unquote, quote unquote, because of a GLP-1 deficiency? Or is there an underlying mechanism that maybe these GLP-1s address? So rather than looking at it from a drug perspective, should we be looking at it from a mechanism perspective? So let's talk about this. So it says, should Ozempic be added to the water supply? This is the kind of half-joking question that doctors kick around when a new class of drugs begins to help a big chunk of the population, right? So they talk about how it's beneficial for weight loss, how it's beneficial for type 2 diabetes, how it's beneficial for kidney disease. And then they even talk about liver disease, sleep apnea, arthritis, Alzheimer's disease, alcohol addiction. Especially interested in what they talk about for liver disease, right? So let's go to page A4 here. And why I want to talk about liver disease is because it really highlights what I think the underlying message here. All right, so doctors are also seeing success in treating people with certain liver diseases. Dr. Isaacs prescribes GLP-1s for people with a fatty liver condition called metabolic dysfunction associated steatohepatitis, or MASH, M-A-S-H, which is estimated to afflict 15 million Americans. Okay, so this is the perfect example. GLP-1s improve fatty liver, but it's metabolic dysfunction associated steatohepatitis. So how do we propose that these medications help the liver disease? Well, probably by addressing the underlying metabolic dysfunction. So when we say that these medications can help with heart disease, with liver disease, with Alzheimer's, with neurocognitive disease, with liver disease, right? With all these other conditions, maybe the underlying mechanism is actually improving metabolic health. And I say maybe, but I say that with pretty fair certainty. So when we read this article, every time we see GLP-1s or we see Ozempic and we say it is good for X condition, it benefits X condition, what I would do is take out the GLP-1, take out the Ozempic, and instead put improving metabolic health improves X, Y, and Z condition. That's how I think we should read this article. And I think it should be rewritten to say that. Now, you could also say GLP-1s and Ozempic, Mounjaro, etc. help with weight loss, which can help with metabolic health, which can then benefit all these conditions, right? So I think you can draw that connection. But I think it's misleading when you lead with GLP-1s cause X, Y, and Z, when it's really the metabolic health. Now, in fairness, at the very end, the authors do talk about the cost, over $1,000 per month for many insurance, and that there's some side effects, of course, that come with these medications. And I don't want to say the medications have no role. These medications can be life-changing for so many individuals who've struggled with weight loss and struggled with their metabolic health. But I think the point is we don't suffer from a Mounjaro deficiency. Right? We suffer from metabolic dysfunction. We as a population, as a global population that have caused all these epidemics. And the way to treat that is by improving metabolic health. And that includes exercise. That includes sleep hygiene. And that includes nutrition, proper nutrition that can aid with sustainable weight loss, that improves body composition and improves metabolic health. And oh, by the way, there's one version of that also has been shown to have direct cognitive and psychiatric mental health benefits, a ketogenic diet. Doesn't mean a ketogenic diet is right for everybody, but if someone thinks they've quote unquote tried everything for their metabolic health, but they haven't tried a keto diet, they haven't tried everything. So again, doesn't mean we can't use medications, doesn't mean medications are evil, but it means we have to make sure we're putting them into perspective, right? We don't have a GLP-1 deficiency, we have metabolic dysfunction. So reread this article and insert improving metabolic health everywhere you see GLP-1s and see how it reads, and see then how we can, as a society, as a government, as physicians, as individuals, how we can approach these epidemics we see, and see if maybe there isn't another approach. low-carb and ketogenic interventions, combined with weight loss and adequate protein, and possibly also combined with medications used as adjunctive therapy. It opens up a whole world of opportunities that aren't limited to an injection that costs $1,000 a month. Hope this was helpful and maybe give you a new perspective. Thank you for watching. I'm Dr. Bret Scher, and we'll see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.